Hello, my name is Stauffer, Director for Strategy and Campaigns at the Health and Environment Alliance HEAL. Thank you for the invitation and for the opportunity for me to present some of the opportunities and challenges around EU policymaking on environment and climate that influence children's health. My organization, Health and Environment Alliance, is an alliance that brings together over 75 member organizations from the health and medical community working for better health through a healthy environment. Actually, children's health and protecting children as a vulnerable group has been at the core of what HEAL is doing since we were founded in 2003. When it comes to EU policy making, I have some good news and I have bad news for you. The bad news is that unfortunately in the past years, children's health concerns have not been at the forefront of EU policy making, neither in environment or climate or any other issues. There was a peak on looking at how children are affected from environmental threats in the mid-2000s with the first ever action plan on children's environment and health. That was actually the first ever also at the global level. And the recognition of the special vulnerability of children in key EU environmental legislation, such as air quality or pesticides. However, since then, we've really seen a decrease of attention in these issues and other issues like economic recovery or the various crises that EU is facing have been at the forefront. And at the same time, we're still seeing some key gaps in the implementation of EU environmental legislation that will bring huge benefits to children's health. This is the bad side or the bad news. But actually, there's also good news. And the good news is that this year is the year of EU institutional change. We have a new parliament, there is a new commission president, and there will soon be a new EU commission. And from what we've heard from the EU commission president, who is actually a medical doctor herself and a public health specialist, we have seen some promising opportunities in what she has outlined in her speech to the European Parliament and also in her political guidelines. This is what we as HEAL want to build on, and this is what we are looking for, strengthening our working together with you gathered here and with all of these people and organizations who are interested in protecting children from the key and the grave environmental and climate threats that are ongoing. So let me outline some of the opportunities and the challenges for each of the policy areas, starting with air pollution. Air pollution, as we've heard, which is a key threat to children's health. And actually the science in the past years has been very clear, and there's been much more and more evidence on how children are under threat from air pollution, starting before when they're actually born. So starting with the exposure of the pregnant mother and their exposure in utero. The EU actually has a comprehensive framework in place to tackle air pollution, but unfortunately the picture is far from optimal or far from good, with the overwhelming majority of EU member states actually failing to keep EU air quality standards. This means that children and all of us are actually exposed to air pollution when we shouldn't be. And even more concerning, the current EU standards that are in place are actually less strict and less protective than what the World Health Organization recommends, and also what the latest science tells us about the threats and the potential impacts of air pollution. So for the next years, there is clearly much more political will needed on the side of national governments, but also on the side of the EU policymakers to be more strict on implementing the existing air quality legislation, but then also this political will is really needed to actually update the current EU air quality standards to what is needed to protect our health. Many cities across Europe have been changing their ways. They have been at the forefront of clean air policies, including the city where you are gathered today, Helsinki, which, as you might have seen, issues information on air quality on its public transportation system, and that coupled with health information. What does this air quality level mean for my health? What could it mean for my children's health? When it comes to these kind of information and actually alerts in peak pollution, unfortunately, there's very much a patchy picture all across Europe, and there is a need, again, for the next years to have a more concerted effort and to have more of an alignment to ensure that everybody in the society, but especially parents or others who are concerned about children's health, receive all the information that allows them to make informed choices then. We've spoken about air pollution. Now what about chemicals, especially endocrine disruptors? And again, we've heard before in Elke's presentation on the science. Endocrine disruptors, regulating endocrine disruptors, has been a hotly debated issue at the EU for the past years. And unfortunately, a lot of times we've seen a questioning of the evidence and of the science, which means that, you know, it could have been, or, you know, it was also seen as a way of preventing regulation. Now we as HEAL think, and I personally think, that we cannot afford to wait until all the evidence is out there. And actually we cannot wait until we have seen the harm in children, especially knowing that, you know, from the exposure to a pollutant and up until we see health effects and health impacts, this may take a very long time. And actually this can happen only decades later. We want to act now to prevent ill health in the future. And this means that we need regulation with a focus to prevention, but also based on what we call precaution and the precautionary principle. For chemicals, for endocrine disruptors, this means speeding up and really using the existing regulation that we have to reduce exposure. So in the EU landmark chemicals legislation called REACH, speed up the identification of hazardous substances. For endocrine disruptors, you know, now that we have the criteria, really apply them to identify pesticides, that those can be phased out then. At the same time, with a view to reducing the exposure of children, this means also including, or, you know, kind of designing regulations that cover all the ways how children can be exposed, all the ways we are exposed to chemicals in our daily lives, meaning, you know, also looking at the way, you know, food is being wrapped in plastic that we are using, and especially for plastic, making sure that there are no harmful substances in plastic, for example, in plastic toys that children are using, they're taking into their mouth and playing with it, and reducing the plastic use in our society overall. The EU Commission President Ursula von der Leyen has promised a strategy on zero pollution, which we're quite hopeful about, and we actually want to see to come to light soon, because this is very much needed to reduce chemical threats to children. Ladies and gentlemen, in the past weeks, we've seen a big movement rising in Europe, but also globally, demanding greater action on climate change. The World Health Organization has called climate change the greatest threat to public health of the 21st century. At the same time, we know that ambitious action to mitigate and to try to limit global warming to 1.5 degrees will actually have many huge health benefits, including from increased walking and cycling, including from less air pollution through a phase out of coal power generation, including from less reduced meat consumption and other ways. There are many, many ways in decarbonization that will actually bring benefits to all health, but especially to children's health. When it comes to EU policy making, again, this will be a priority for the next years. And what is important is to include the perspective and the need to protect children and be really ambitious about this. This means that for the EU, but also for member states, we really need to step up, or policymakers need to step up in achieving greater CO2 emissions by 2030. The proposal or the kind of commitments we have so far are inadequate, and we know they will not be able to limit the global warming to 1.5%. And also for the new policy proposals that we're expecting with an EU Green New Deal, again, we need to be really ambitious because we owe it to the children, to the next generation, to protect them and to actually put Europe on a path that will ensure their health, in the decades to come. When we talk about climate change, and we talk about all of these other environmental threats to children's health, I think it's important to not only demand demand high or aim high for policymakers. It's also a question of what each one of us can do personally to step up in their commitments. This is why I have decided to not join you in person in Helsinki, to limit or to reduce my carbon footprint, but to give you this video message. I know that many of us are doing this as well. So it's a question also with a view to protecting our children of what each one of us can do in addition, how each person in this room can step up and then join together to actually ask our policymakers to do the same. Ladies and gentlemen, the challenges that children are facing from environmental degradation, from pollution, and from climate change are huge and they're enormous, and they demand an urgent answer. Health and medical professionals all over Europe and all over the world have been engaged and actually have had their voices increasingly heard to address these issues. I'm pleased to know that many of you are gathered today in Helsinki, and I hope that today's meeting can really be the start and can really kickstart for a joint effort for all of us to bring children's environmental health concerns back to the forefront of policymaking, be it at local level, be it at national, be it EU and international level. We owe it to our children, and they really need our support and our stepping up for this issue. Thank you very much.